45 minutes to an hour.
At
8 o'clock.
Was it
we
8
will-
o'clock? You gotta shut up now?
Yep, we're an hour and a half right now.
Well, no, I got another meeting at 8, so.
All right, it's 8 o'clock. We'll call the March 21st, 2024 meeting of the Sherburne County EDA to order. Strap in for another exciting hour and a half. I'd be looking for a motion to approve the March 21st agenda.
I'll make a motion to approve the agenda.
A second.
All in favor?
Aye.
And opposed? Approval of the February 15th County EDA meeting minutes.
I'll make a motion. They be approved.
Got a motion?
I'll second.
Second, all in favor?
Aye.
All right, number 4, the approval of the February 28th Cargill Big Lake Facility Tour meeting, which was a great tour. Thank you very much. We still need to prove that we were there.
I'll make that motion.
All right, we got Andy and Rand on the table. Who wants to take the second?
I'll take the second.
Rand's in on second, all in favor?
Aye.
All right, on to business. We have an HHS updates on housing and healthcare, two things that we have been talking about for quite a while in EDA. So, Jessica, you queuing this up?
Sure. Yep, so I had invited Julie and Meg to come and speak to childcare, kind of our work in childcare from the HHS perspective, and if there are any opportunities that the EDA could somehow partner in that. Unfortunately, Julie is sick, but Meg is here, and so, I'm sorry, Meg is
That's
sick,
okay.
Julie is here.
And it's Anna, who is my childcare licensor, who's out sick today, so, yeah.
Oh,
So it's
okay.
just Julie today, sorry.
We'll take it. So I'll let you go ahead and there's the,
Do you want me to go up this?
yep, there's a mic
Okay.
up there, and then the clicker is also up there, and you can just take it away.
Good morning, I'm Julie Melsna. I'm the supervisor of our licensing and intake unit in HHS. I was asked to come present some data for all of you this morning on our childcare homes in Sherburne County. So we put together, I don't know, 5-6 slides for everybody. Do I do that? Switch it? We'll see how this goes. I'm not tech savvy. Yay. Okay, so a few definitions about childcare. We have infants 6 weeks to 12 months, toddlers 1 to 2, preschoolers are 2 to 5 years old, and then school agers 5 to 11. And a lot of that is important because it depends on licensing types for our providers in Sherburne County. So we just highlighted a few different licensing types and what it means just for all of you. So you could get a Class A license, which all new license holders start out with this license. There's a max of 10 children, of which 6 under 5 years, of which max 2 infants and 1 toddler. Then you can move on to a Class 1 C1 license, again similar, 10 children max, of which 8 under 5 years, which max is 2 infants and 1 toddler. Then we also have a Class 2 that bumps up to 12 children max, 10 under 5, max of 1 infant and 1 toddler. We also have Class 3, which requires 2 adult caregivers at the time, 14 children max, of which, I must have forgotten that data. Sorry, I can get back to you on that. Class B, specialized infant and toddler license. So special family child care, special licensing conditions, it does not need to be in the licensing holder's home or license held by a church, nonprofit, etc., with a max of 14 children present. A majority of our providers have a C1 or C2 license, and only a handful have a B license. There's only one specialized family child care in Sherburne County. So we thought we'd highlight some trends that we've seen over the years. With the total numbers that have been outlined, there has been a decline over the past 12 years until 2022, when numbers remained stable. In 2023, there was a slight increase, as you can see highlighted here. I don't know if you want me to go through all of those. But what we are seeing is a lot of our long-term providers are tending to close license because of all the requirements needed and requested by DHS, feeling like there's a lot of demands, a lot of needs of them. So we're really working collaboratively with our providers to try to support them and help them because their job is important and we value what they do for our children and our community. Whoops, sorry. So the process. In 2021, the application process was changed to be mostly online. Like we do orientation, so it's accessible to, and that's accessible on our Sherburne County website. People that are interested in becoming licensed reach out to our licensor via email or phone and request orientation. Sherburne County Health and Human Services provides a lot of guidance through this process and assists with questions and guidance in regards to start to finish process for our providers. This process is going to change in a few ways this summer as DHS has implemented a new system which will require all of our providers to do all orientation online, including documentation, background studies, etc. It's quite intense, and it's going to be a process of training our providers to get them up to speed as well. So just wanted to highlight some barriers, some reoccurring issues. The overall ability of infant and toddler spots in new families with twins are very difficult to find, especially with infants in our community. Providers are unhappy with some of the laws and regulations pertaining to the home safety requirements. I touched briefly on that with DHS and some of the changes. The lack of qualified substitutes. Some providers regularly need a day off or half a day off, which result in no care for families, which leaves parents scrambling at the last minute. Sherburne County only has 3 substitutes that serve a few programs. Financially, lack of health insurance, cost of home maintenance or home standards such as annual well water visits, requiring fencing and some cases of hazards along the property line. So Ms. Anna is not here, but I'm willing to jot down questions or try to answer those if there are any. I know there was one thing that came forth. I believe, Jessica, you had inquired about centers, and we don't license centered childcare facilities. We do independent childcare, like our typical daycare homes, not like a Red Balloon or a New Horizon, those type of things. So I just wanted to make that clear with Sherburne County and our licensing.
So then the state licensed the
Correct.
bigger facilities?
Yep.
Question on the well water testing. Is there like a more in-depth well test needed than what the county sends out for testing packets?
I believe it's just the testing packets that are sent to them, but again, the cost where some providers will ask the county to assist with that.
And you'd have to help me on that. I thought that we kind of, do we do that upon ask, or we do that upon, it's a minimal cost, I thought, if you do it through the county, isn't it, Mark?
I moved over to the, I think, to the HHS department now, but it was $25 or $20, I think, is what it was when it was in our office.
Yeah, I believe it's 30, maybe 28. It's not, I mean,
Maybe it's gone up a little bit over time, but it's the labs, I think, maybe.
Yeah, I was just thinking when they say that the cost of it, I'm thinking, was it a couple $100, or if it's in that range?
yeah, my understanding was it was like under $30, around $30, $32.
And they're aware they can get one through the county at a lower rate than what they would if they contacted a.
Yeah, again, I'm guessing that Anna does reflect that with her providers, but I can verify that for sure.
Thank you.
Do you have any statistics on what the actual backlog is for families that are trying to find childcare as opposed to what's available? Generally, like what's on a waiting list, or how many of your providers have waiting lists?
And again, without having Anna here, I'm sorry. I will write these down and then I can send them to you, Jessica, if you're okay with that.
Yeah, I do know First Children's Finance has done a study of the cities in Sherburne County, and I want to say the city of Elk River alone had somewhere around 1,000 slot deficit. I know Becker has 265. I'd venture to guess Big Lake's somewhere in between there, if you know. So there's
So the numbers are
easy a couple
substantial.
thousand slot deficit.
And it's
in Sherburne
affordable
County.
because there are slots open at the centers.
but people can't afford it.
Mhm.
So it's an affordability issue.
Yeah.
Yep.
Because that's where we got hung up at the Y, is because we're like, well, all of our childcare centers in the Y, I work for the Y of the North, I mean, we're the largest provider of childcare in the state of Minnesota. Every single one of our childcare centers, ECLC, so early childhood learning centers, that's birth, or 6 weeks to 5, they're all losing money. Our SAC sites, school-age childcare makes money, but they're all losing money. So and we're still haven't recovered from COVID. So that's the issue, is cost, and families just can't afford $300, $350
Per child.
per child for childcare. And that's what it costs.
Per week, right?
And you
Molly,
have,
that's full-time only, correct?
Yeah, that's only, well, there's some places for an infant, it's $350 for part-time a week. Like at the Goddard School and at Smullins, yeah. So there are spots, like if you call, like you can get, I've done it in the last 90 days. You can get in spots in centers, but I mean, upwards of $400 for $450
a week, right?
a week per child. So that's the main issue.
And
And staffing, they don't have enough staff for their
I
centers
was just
either.
gonna say, staffing has been an issue as well, of hired staff to
Yep.
assist.
And if you're someone trying to find daycare for your child, like if you're planning one or having one, you gotta start now.
Yeah.
With getting your
Yeah.
site, and then you pay for it to make sure you secure it until the child, yeah, that's how bad it is.
Like what we're seeing too is with families with multiple children, daycare may not have an opening for the infant to bring in the infant, and then you have that whole, are you at 2 different daycares?
Yep. Yeah, so really when we started talking about it, we're like, it needs to be a collaboration, like between, maybe it's cities, it's businesses, and an agency to make it affordable. And businesses have come and said, like, we're open to talking about it, especially like your sport techs and your, manufacturing, because they can't get staff. But there's a lot of licensing issues with having an on-site daycare in a manufacturing place like Cargill or like, but again, we have to change the narrative, right?
Are there any benefits that ever exist with companies to support childcare? And I'm thinking, that offset some of the expenses. When you think about like a benefit package coming to a company or to an employee. Is that anything that's ever been?
Jared, that'd be a good question for you. Has that ever come up? Sorry, I was thinking through Ray Ann's question right
Oh,
there.
I'm
so
sorry.
repeat that.
Are there any kind of incentive packages, kind of part of your benefits, that offer some kind of childcare offset,
Currently, we don't have one, but we did so I was just thinking through with Ray Ann, we did have a task force specifically around this because it is such a challenge in the industrial and commercial area, especially on anything that's, we call your non-typical hours, right? Anything after, 4 or 5 p.m. and then through the night. I actually will see if I can go back and see where that, get the report out from that task force of what they did. But I know we at the time were specifically looking for the Monticello, Big Lake, and Elk River locations for Cargill, if we could do something with either subsidizing childcare, helping out a local provider, or actually even looking at doing like an on-site type build thing as well too. But I don't recall where we ended up with that. Obviously, we didn't move forward at the time, but that'd be something I'd be willing to go back and get and provide to us as well too.
I can't remember what employer I talked to, but they give their employee benefits just in the form of money. And they can choose if they want to use that towards their health insurance, like if they need it, if they need health insurance, or if they don't, maybe they're covered by their spouse, they still get that same dollar amount of which they could put to childcare or what have you. That they actually need to use it for, not what the employer says that they're eligible to use those dollars for.
That's kind of a good idea.
Yeah.
Can I ask a question about home-based daycare? Because anything about the planning zoning world or kind of that regulating. Question about home-based daycare. So it's a decrease, and I think it was said because of additional regulations and some changes, 2021. And is there anything kind of on the land use side that creates conflicts for these folks, or what are some of those big obstacles that they're facing? Getting licensing through the state level.
Yeah, and I haven't had those direct conversations with our providers, but I will definitely report back as well.
Because it's the home base that I think are more affordable, And as far as like our land use regulations, we have very minimal land use regulations, so I think it kind of goes over to where the state is licensing.
Yeah, I think it's state regulations of what
I
you
just
have
wasn't sure
I
what
think it's
those,
what you have to do inside your home
and the fencing
and the fencing outside your home. I don't think it really is anything that, land regulations impede.
Yeah, and I would piggyback on that. I think it's been more of the expectations of our providers, like exactly how the daycare is run within the home, who's in the home, what helpers are, past backgrounds, ratio, all of those
And
things.
if they participate in the food program, that's a whole nother set of regulations. But you almost have to in order to try to make your business break even, participate in that food program. There's a lot of reporting and things involved in that.
And then, of course, anytime there's a negative incident in a home daycare, the reaction at the state level is to put more regulations on. And so I think it just kind of builds over time where it's like stack another regulation, instead of recognizing it was a very unfortunate incident.
Right, and one thing that I've heard too, just through our, the Rural Child Care Innovation Program, Becker, is childcare providers, they're open, let's say, some open at 5, 6 a.m., and then they don't close until 6 p.m., but that's when they have children there, so that's not when they can do their shopping, their food prepping, all of their regulatory paperwork, their CEUs, everything else, so they're putting in a 12-hour day with kids there, and then the kids leave, and they gotta get everything else done. They gotta get their place cleaned, so they're working a lot of hours in a day, and that's where it becomes very cost ineffective to run a childcare business.
Well, we have providers that shorten their hours, and then that affects parents working to get back to pick children up by 4:30, and yeah, it's just a struggle.
I had a question about the online training program. So did you say the state is moving all of their required provider training to online? Is that to try to be more efficient or get more compliance, or?
Both, exactly. And they're rolling it out slowly, so it's going to be quite a change, because currently our licensing social workers go out and do all of it over multiple home visits with the provider. They'll attend a orientation, we send them tons of paperwork, they do the paperwork, and it's coming and going back and forth, but it's all gonna be in a hub that is through the state, where it's all completed, checked. I mean, it's gonna be efficient, I think, once we get it rolled out and it starts happening, but we have to train everybody. We have providers that may not be up to speed with technology. That's been a legitimate concern of, I don't even know how to use a computer, and I don't have this in my home. So really looking to how can we best support them and provide them with all the resources that they're gonna need as well. It's gonna be a big shift.
And then I didn't even know that Sherburne County had a sub-program. Can you tell me what that is?
So, yeah, and Anna could speak to it more. There's providers that kind of share, if there is somebody who's passed a background that's available to reach out to, of, hey, I got an appointment on this day, are you able to come in? And it's somebody who's passed background checks, who's done everything, the appropriate training needed. Like, it's just another provider that can come in and care for children in the home while that provider does A, B, and C. So, yeah, I didn't realize we had 3. I thought we had a few more than that. But they can use this provider to assist them with their needs. But 3 is not many when we have 168 childcare homes. No, that's not many.
So is the childcare provider who needs the sub, are they then responsible for reimbursing the sub?
I believe so. I can't answer that specifically. I'll have Anna talk to that. But I believe it's up to them then for that.
So then they're losing out on their wages that day.
Or they have to close their daycare or leave early, or, yeah. And then parents have to leave work early, I mean, it's just.
So we know there's a problem, what can we help with? Is there anything we can do?
Yeah, let me get back to you on that one. I'm sorry, I wish she was here to really speak to that. It's, oh, go ahead.
As I say, one of the things that's interesting with the cost of daycare going up like that, there is a program, and it's way above us, but the Dependent Care Flex program, that's been at $5,000 for, I know, at least 15 years. So you would think, when you have the flexible spending accounts for your medical, that goes up with inflation every year. But I don't understand why they don't increase, because like you said, at $350 per child per week, you're looking at about $18,000. And only 5,000 of that can be used, in that flexible spending accounts. So even if they did raise that up, then employers could start maybe contributing a little bit of, kind of like the HSA stuff, where they would contribute to a childcare. That would help with offset the cost of the centers.
Maybe that's something we can help advocate for, that change in that program that Andy's referring to.
Because you calculate it out, it's,
The cost. I mean,
It's
I
still
have kids
high,
at that age,
right.
that, or, it's expensive, owning a home and, trying to.
But like Andy's referring to, if you have an HSA account, if they increase that ability to put it towards childcare from 5,000 to greater, at least gives you some, because your employer is putting, money into the HSA account, so.
Okay, any other questions, comments? Well, thank you for your time.
Thank you.
We appreciate the information and,
Yeah, I
yes, this
will.
is part of our strategic plan, so we will continue discussion.
Wonderful, thanks you guys. I will get some answers for you and send those to you.
Then you'll send
Thank
them
you,
out
have a
now.
great day. Good stay for housing, I'm familiar with that.
Are we able to just sit here
Yeah.
instead of going up to the,
Sure.
thank you.
All right, moving on to letter of support for affordable senior housing development.
So we have Derek and Tony from Health and Human Services to give us a housing update.
Okay, so,
When first
Is there a
approve the
letter
for
of
Elk River
support?
for the letter of support
We're on number 6.
for
No,
the
we're on 5.
Twin Lakes.
The two-parter on 5.
Oh, two-part, I got it. Sorry, my mistake. Sorry, guys.
The letter of support came first after, so my packet is kind of reading the same way.
Oh, did it?
Yeah.
Well, we're good.
Sorry about that.
all right. Well, hi, I'm Tony Masters. I am the manager of the Adult and Disability Services Division here in Sherburne County. That includes our Housing and Outreach Unit, which Derek can introduce himself, and he's going to get us started on the conversation here.
sounds good. Good morning, you guys. Derek Maygard. Tony and I are both kind of under the weather. I think I actually got him sick, so I'm a little bit progressed farther along than he has. So bear with our awful voices. I'm Derek Maygard. I work with Sherburne County Health Human Services. Like Tony said, I supervise our HOPE team. The H, HOPE is an acronym. The H is for housing, and so that's what we're going to talk about this morning with you all. Did you want this one, or you want me to keep rolling?
Keep rolling.
Okay, so mission and goals, you guys can kind of see our fancy little slides here, but we have different monies available, some of which have ended. We had some CLI grants and things that have been helping pay for our positions. So we'll get here in a second, but we have 2 housing social workers that work within my and Tony's division. One is a housing outreach social worker and one is a housing resource specialist. We'll talk a little bit about what they do here in a second. But they started back, excuse me, the resource specialist started back September of 21, followed up by our outreach social worker back in August of 22. So we've had both of these folks for a little over a year now. Again, joining an actual housing team October of 23 last year. Current programs, again, we have a full-time outreach housing worker. We have a full-time case management, short-term, long-term resource specialist. Ashton Minke is our outreach social worker, and Lori Irwin is our full-time case management resource specialist social worker. They both do a lot with housing. Direct assistance, we have some direct assistance too, so we've been helping folks that apply for, we encourage them to apply for emergency assistance through the county first. If they're denied for that, or if they've already used those funds, or if it's just not appropriate for those funds, we've had some direct assistance, we still have some direct assistance that we've been helping folks out with for various different things, damage deposit, first and last month's rent. If they need to get caught up from a few months behind before they face eviction, those types of things, moving expenses, we've helped folks buy beds, different furnishings. Sometimes we have folks that are moving into their first apartment ever. We've been able to tap into these funds, these direct assistance funds, to help with, different furniture things for their first ever apartment. It also helps pay for the Keeping Families Together program through those social services. And that program is still up and going, and you can see the amount there that we've given to them.
And that program is working with families with children that are coming through our child welfare system. So helping to avoid out-of-home placement with kids, and it's been fairly successful thus far.
All right, housing outreach. So these are just some bullets of what Ashton does. So engages individuals and families to assess and evaluate needs and strengths, including safety and risk. Provide immediate response to crisis situations. So what that means is when folks call into Health and Human Services to actually Julie's team, they create an intake if they have immediate needs. Those referrals then go to me, and then I read through them to decide if they're more appropriate to go to our resource specialist. Maybe they're currently housed, but they're trying to find something different. There's not that immediate risk. So if somebody calls in that's homeless, on the spot right now, they'll get immediately assigned to Ashton to do some engagement for housing outreach. Ashton's also going to like encampments in St. Cloud. There's folks that are living in homemade tents or have a homeless tent package that we've given them by meeting them out in the streets, and they're living in these tents. She goes out there all the time to visit with them. She's going to different outreach locations too. We have an outreach location in Zimmerman, Big Lake, and several in St. Cloud that she's out at a couple of times a month. So folks are able to come there. Salvation Army is a big one in St. Cloud that folks are homeless at. They come there, and Ashton's able to engage with them there as well.
It was interesting, Derek, to see like what some of those encampments look like. In the St. Cloud, the one that you had visited in the Sherburne County area, I mean, what it reminded me of is pioneers had built dugouts. And that's what people are living in, and they're trying to engage those individuals to get them into stable long-term housing.
Yeah, for sure. Okay. And then our resource specialist, so Lori, she's available for, if they already have a social worker, for a lot of it is like child protection, child welfare related. If they have a social worker, but the parent of the kid that's they're working with is homeless or needing help with finding housing, maybe he or she is in a chemical dependency treatment program or something where they don't have any place to go afterwards, they're tapping into Lori to get resources for that. She also gets assigned those folks that I said a little bit ago that maybe are doubled up living with mom and dad or living with a friend, but they can only stay so long there because the lease only allows 30 days to have a guest. And so those types of folks that she's working with and helping find housing as well. Or she works with a lot of people too that have gotten that eviction letter, maybe have 30 or 60 days to be out, or that are struggling with financial aid and maybe they need to help make a referral for some financial aid through us. And then also she's had a lot of appeals lately too. So with different apartment complexes denying people based off of whatever, it might be their rent history or their credit history or maybe previous evictions. Lori helps folks appeal for that process too to try to get them to reconsider. All right, some data. 161 referrals in 23 between Lori and Ashton's two positions. So a pretty incredible number. You can see the stats there as far as folks that were stably housed when we got a referral, which just means, they're content where they're at, but they want to get out, or maybe mom and dad, or maybe the one main one that's been for stably housed has been mom and dad who are in their 80s and a child who's like 50, 60 years old, and it's just time for them to get their own place, so then they get referred to us. Rent burden, at risk of homelessness, leaving an institution, so chemical dependency treatment, maybe one of the security hospitals, those types of things. unsafe living conditions. We've had some referrals lately from last year too, with like floors that are falling out in old trailer houses, roofs that are collapsing, things of that nature, things that have mold, just that are not safe. Doubled up is a big one, and then imminent risk of homeless, and then of course homeless folks that we've run into at those encampments. We've run into a lot of homeless people too at Walmart here in Elk River, living in their cars out in the parking lot, and Ashton spends a lot of time out there too, so that's where those homeless referrals come from.
Is it my turn?
Is it? Okay.
You know, one interesting one to talk about, Derek, is that referral you got from the county attorney's office, because that was a little bit outside of the box of what you've typically done. Could you explain that one?
Yeah, so we got 4 households back in November that were past 4 years behind on property tax. So they were at to the point where it had gotten from our office here to Kathy Haney, county attorney's office, to basically take those 4 homes away. And so we got creative with that and sent out housing workers to those 4 households. They had already been contacted a bunch of times via mail, phone calls with just no responses at all. These are folks that were thousands of dollars behind on property tax, of course. And so all 4 of those people ended up engaging in different capacities. 2 of them caught up on their property taxes, so we were able to avoid them from losing their homesteads. And then 2 of them are continuing to work with the office here to get caught up, but they've actually engaged now via email and via phone, which is a heck of a lot more than ghosting us the whole time. So it was pretty successful.
I guess you do have the locations of referrals too.
So a couple just locations for referrals. You kind of see the numbers there, but Elk River's a big one. Big Lake's a big one.
Yeah, and I think going back to when we first rolled this out, the heaviest was in the Elk River and Big Lake areas, and then moving up into St. Cloud. So this has been fairly consistent since we've had the housing staff.
And I think that helps us get a visual because those are numbers nobody would assume are real numbers.
I would have assumed that the majority of our homeless population would be in St. Cloud.
So they are very eye-opening.
Yeah.
And we know that we have issues in our local communities that we would not even think would be happening.
Well, I guess you're still on.
I still got the mic. A few more barriers: lack of affordable housing, so rent costs continuing to grow. Of course, things that used to be $400 a month to rent are now $1,400 a month. And we work with a lot of folks that are on Social Security because of disabilities, whether it's physical health or mental health, and they're at a set stone, $800 a month, that's all we're getting. Lack of landlords willing to rent to people with criminal backgrounds. Again, we get a lot of those referrals with people that have felonies, poor credit. We're getting a lot of younger folks coming in too that have no credit at all, have never rented before, have never had a credit card where they've had to pay and build some credit. So they're struggling to find housing as well. And then, of course, previous evictions is a huge one in this area too. And then just lack of housing options that are income-based or we call subsidized housing that's available. That's only a certain percentage of their overall income to help them afford to move into those places.
Can I just ask, in the slide that was just previous with the numbers on, do you,
Excuse me.
is that just from requests that came through the county?
Yes.
Okay,
Yep.
I just had another meeting with Kat at United Way, and she said they're getting lots of calls.
She told me that too. I saw her 2 weeks ago.
Okay.
Yep.
And Out of County was on that list too? How does that work? Will we help?
So there's things called excluded time services. So if somebody, let's say, is in an inpatient mental CD treatment program, they might be in a residential program outside of Sherburne County, but continue to be the financial responsibility of Sherburne County because this is where their home area, where they have lived prior to going into those excluded time settings.
What safeguards do we have too to make sure that we're helping and getting the needs met, but there isn't duplication?
So we've, as far as duplication of services, because there are community-based services can assist with this too. We, through our intake process, try to weed out those that can be served by those community-based services and we'll direct them that way. There's medical assistance service called Housing Stabilization Services, and we have community providers that provide that. And if they're eligible for that, we will try to guide them over to that. However, if they have an immediate need to become eligible for that housing stabilization service where they'll help to find the housing, could take 45 to 60 days because of the backlog at the state level. So, and what we often do through the case management role that Derek had talked about for our housing resource specialist, once those same people are stably housed, there'll be a handoff to one of those community-based providers if they're eligible for that service. So just a couple stats here on the direct assistance that has been dispersed for various households going back this 18-month period. Both in the grant-funded one is the first one that you're seeing. 65% of those that were supported through those direct assistance funds were families with children. With our emergency assistance programs that are managed through our economic assistance area, 75% were families with children. So this isn't just your stereotypical homeless adult that's wandering the streets. These are kids in very vulnerable situations. So I wanted to talk a little bit about pilot programs that we're working on right now in Health and Human Services. So there's two that are the priorities that we're working on right now. Apologize, you get winded here easily. Housing support funding for in unlicensed settings. What that's referencing is a state program called Housing Support, formerly called Group Residential Housing, because it was only used in licensed settings historically. So we have, I don't know what it is, 100, 150 adult foster care programs where they get housing support to supplement income of those that are low income to pay for their room and board. And then hotel voucher program, this is based off a model that we had observed with Carver County. I'll get into a little bit more detail on that in a bit. So housing support as a state-funded program, we can use this in community-based settings. People that access it have to have some sort of disabling condition, whether that's a physical disability, mental health disability, intellectual disability, chemical health could be a qualifier. But like I said, it'll help to supplement income, so to make rent affordable. So it does work for folks that are over the age of 65. There are some income limitations on that. But what we're seeing, and the pilot we're doing right now, so far we've successfully housed 2 households using this program. So folks that were homeless with disabling conditions are now in an apartment that's made affordable through this housing support program. The exact income per month, I think, is $11.35 per month before they become ineligible for that program. The other pilot that we're working on is a hotel voucher pilot. So this is, let me just look at my slides here. I'll start there. When we were looking at expanding some of our services, particularly housing support, we connected with both Carver and Scott County to see what they've been doing, because in the metro counties, they've been utilizing housing support in unlicensed settings for quite a while. So we're just playing catch up right now. One of the things that they had talked about as we were exploring that was this hotel voucher program. How it's being utilized is people that are experiencing homelessness, they can get them immediately housed into one of these hotels that are willing to work with the county. In the Carver County model, I think their average length of stay was 90 days. We're looking at trying to make that about 30 days. We have met with one hotel thus far that seems like they might be interested, but we want to find hotels across the county so people can really stay in their home areas too. But this hotel voucher program would be a combination of housing support and a grant program through the Office of Economic Opportunity that could help to pay the cost for this. Where this would dovetail nicely into the housing support program is that if they're accessing housing support in this short-term hotel housing, our housing folks would begin immediately working with them to get into long-term housing. And if already been determined eligible for the housing support funding from the state, that could transition into their long-term apartment then as well. So in the Carver County model, about 80% of the folks served in this hotel voucher program transitioned into long-term housing, utilizing that housing support program. So we're hopeful we could see similar results to that. Assistance needed, and Derek can speak to this a lot better than I can, but we still needed to build relationships with local property owners that might be willing to rent to folks with some of the barriers that Derek had discussed earlier. We're still looking for hotels that are willing to partner with us on a hotel voucher program. And another thing that we thought was worth mentioning is the TIF programs. I didn't know what that term meant until a few weeks ago, but there's been a few of these tax increment financing developments that have occurred or opened over the course of the last 3 years, I'd say. And they have really been a boon for our housing staff because one, they have units that are dedicated for persons with disabilities and for folks that have experienced long-term homelessness. And they have specific units. I think most of them had between 10 to 13. The one in St. Cloud had like 40.
It goes according to the project.
Yep, it's according to the project, exactly.
1% of the units have to be low-income to qualify.
For the length of the TIF.
Yes.
Right. And so what's nice about that too is those units that are specific to persons with disabilities or long-term homeless come with a service component built into it too. So those, basically, if we can get somebody into one of those units, then there's no need for, say, some of those other wraparound services that we might employ. The other part is for those that aren't income eligible or they're persons with disabilities or don't meet long-term homeless criteria, the rent is generally much more affordable, and many of our clients can afford the rent in those programs.
Have we reached out to, I know Aon is building a facility in Big Lake. This one is a senior project. They're still working on getting their federal credits to support an affordable above senior. And so have we reached out to them to work with them because they are a nonprofit. They have lots of programs and stuff. Are we working with them already?
Yes. So the two developments that are coming, one is the Aon one that you spoke to, and the other one is Trellis. The service provision of services is the TRICAP and RISE, and I forget which one is for which. So we've been having dialogues with them already. I should say Derek has been, because we want to, if we have folks that are eligible to get into those designated units, we want to capitalize on that.
Perfect, thank you.
So you have our contact information here. I think we have questions.
Did you want to mention the Avivo proposal too? The Avivo proposal that St. Cloud's looking at?
You know, I don't know that I can speak to it in detail. I've been more on the outskirts of that one. Bruce?
Absolutely.
Okay. So there's another group we already do business with called Avivo. They have 100 unit acute housing facility in Minneapolis, and they're looking at possibly building a 50-unit facility in St. Cloud. It's very successful, but it's very kind of cutting edge. So they're like individual pods. So it's basically just a bedroom and private area, and they're lock and key. And you can imagine these pods are in 4 blocks, and there's all these blocks in a large warehouse. But it is in essence a wet house or a housing first philosophy. So we went down and toured it about 2 weeks ago, and the city of St. Cloud has endorsed it, and we'll put in some funds. And then the request will come to Stearns County and Sherburne County and Benton County to also support it. So it'd be a 50-unit acute homelessness shelter or facility in St. Cloud. If you're interested, you can go online and look at it. It's run by a nonprofit, very, very well run, but again, it's very cutting edge in terms of just acute homelessness.
So is that a long-term housing or a short-term?
It can be. They do have residents up to a year, but the idea is to stabilize. So again, it's the housing first philosophy. You get people in, you get them stable, and then you start dealing with the other issues they're dealing with. Now,
I have a very cool 8-minute video, sorry Bruce.
No, no, please go
8-minute
ahead.
video online on Avivo too, if you guys have any more curiosity with it. Just, it kind of tours yourself through it, the 8-minute video does down in Minneapolis, and talk about the services that they have inside of Avivo as well.
Yeah,
It's
and if
it's
you
cool.
want, we could even try to pull it up today. if
Is
Christie's
that
got
one that, they're putting housing, like little pods inside of
Yeah, big
a
warehouse.
big warehouse
Yep, yep.
structure?
Yeah, yeah, and it, I mean, it was eye-opening because they have Narcan in every room and they have crash kits in the hallway. But their success rate is actually pretty high for homelessness, so they typically get people stabilized and then they move on. The one in Minneapolis is not a family shelter. They do have other shelters for families. This is for individuals. It's also not for minors, so it's just very, very simple, but done with respect and dignity. But also, like I said, it's a wet house concept, so it's pretty straightforward.
I am aware too that I just got contacted recently in the last couple of weeks that there's something that they're noticing, the commuters that are on the North Star are noticing an increase in homeless population on the North Star. So they come down on the Link bus, get on the North Star, and then get off down in the cities. And, you know, as we all know, they normally have some mental health conditions and substance use conditions. And so it's being noticed on the North Star that this is something that they hadn't had before. So I don't know if there's like a timeout, you know, kind of like you've timed out of all the services you can get, and then you're gonna go down and possibly.
Yeah, I don't know that we've seen anything like that through our intake unit. That's where everything is filtering through, and, you know, they're checking to make sure people are actually our financial responsibility, which is harder to do with the homeless population, but if it's somebody coming from, let's say, a homeless shelter, that would be identified and they would remain we wouldn't be the county of financial responsibility on that until that person has been here for some length of time.
Yeah, okay.
But I think what could be, yeah, I think what could be happening though
is
is, I think there's when you look at kind of the metro train system, that they've had a lot of that, and some of that's maybe getting pushed out a little bit, and so, especially in cold weather months, people are almost residing in trains to stay alive at times, I think.
Yeah, no, they've said that they don't necessarily see them on the reverse commute.
Okay, that's interesting.
So,
Yeah, and on that note, Rand did have me refer that to Metro Transit for enforcement issues too. So you'll see an increased Metro Transit. In fact, there's a Metro Transit police officer up here Monday or Tuesday of this week. So just kind of being and observing and riding. And that was an issue the city of St. Cloud raised, which is if we build a large homeless shelter facility, will we see transition here? And the statistics, numbers are actually, we've got our own problems. So we have more than enough population in need up here.
yeah, because I think law enforcement had to be called out at one time because there was a situation that happened on the Link bus on the way down.
I see.
And so I think, and I contacted Bruce right away because we want to definitely get on top of that if there's going to be an issue and find the right places for them to get their services met.
So does it appear they're trying to get up to St. Cloud then? Is that the?
They're coming down from St. Cloud. And
Oh, they're
then
coming down,
There'll
okay.
be a gap and then they'll head back up.
Okay.
But it won't be on the same day of a reverse commute. And they're not paying for the ride either. So.
All right, any other questions?
I just want to say I appreciate the work that you guys are doing, and the fact that, you know, when you break it down by communities where the homeless are coming, that's a good reminder. It's in our communities, these are our people, you know, that are struggling for different reasons. And it is a good reminder of what, you know, we're doing here. And then when you talk about that, you know, that you're still our responsibility, even if they're up in St. Cloud, you know, or leave our county, so they're migrating to places where it's, you know, less healthy and more detrimental. So the fact that we see it in our communities, I think, is important. That faith base
You had mentioned the outreach places that we visit. Where exactly are those in each community? You mentioned Zimmerman, Big Lake.
Yep, Zimmerman, First Lutheran Church, where they have their food shelf, we're there. Big Lake, same, when they have their food shelf, same thing there. And then we are in St. Cloud at Salvation Army. Promise Neighborhood is a fairly new one for us. And then the CMCEO, which is a Somali-based facility where folks go to there. We're there a couple times a month as well.
And are there other places in St. Cloud? Because I know when you mentioned Promise Neighborhood and you mentioned the Salvation Army, they all seem to be in the Sherburne County the area, or they're in Sherburne County. Is there any other places in Stearns County that, or in St. Cloud that?
Yeah, so warm weather months, we have been going to Cashwise up in St. Cloud because there's a lot of folks that are walking through that area. And I know that's been, Cashwise has allowed us to bring our wellness bus up there and park that. Gina Anderson coordinates the locations, so I'd have to check with her if that's gonna, if we're returning to Cashwise this summer or not. But I know we have been getting a lot of traffic with for Sherburne County folks by being at the Salvation Army as well. And you know that what we get a lot with outreach are people that are accessing economic assistance programs too. So your food support or what are the other ones? MSA, MFIP, those types of things too. But we have both mental health outreach and housing outreach that go to these events.
And does St. Cloud put anything into those events as well for helping to offset costs?
Yeah, so Salvation Army, we sit right with Benton County at the table. And then Promise Neighborhood, we rotate every other, whatever it is, Tuesday with Stearns County.
Thank you.
I have a question. You mentioned that you have some people that come looking for housing and they're younger, they just don't have any credit. So is there like a, I guess what's the process with those folks? Because I know like community education has classes for credit building, wealth building, things like that. And then, you know, Minnesota Housing has their programs to help young people with down payment assistance and things like that. Is there alignment of those resources before they're in like a critical situation?
Yeah, that's part of Lori's role too, is that resource person. She's handing out all of that stuff too. We're helping people get into classes to learn about that stuff too. Budgeting is a huge one too.
So for those community education classes, is there like a partnership with like the community ed where those people could attend those classes for free, or do they still have to pay for them, or do you know?
I guess I don't know. I think that they pay for them typically.
But there's normally a sliding fee schedule. So like if their income is not the greatest, there is a sliding fee schedule at most community education.
Great.
Thank you for having us. And last plug, we're always willing to partner with property managers in the county here. So if you know folks, send them our way that are willing to talk to us.
Yeah, for sure. Thanks, guys.
Thank you. Thank you for the work you do too.
Thank you.
Okay, now that brings us to number 6, letter of support for the affordable senior housing development. I believe this is in Elk River, correct?
Yes. So, I think it was last fall, I got a phone call from Duffy Development, and they had applied for a first round housing tax credit program through Minnesota Housing. Their project did not get picked, so they did not get their housing tax credit, so they weren't able to move forward with that. So I had set up a meeting with them and Minnesota Housing, and together myself, Minnesota Housing, and them just went through their application to see where there were some maybe missed opportunities to get points and how they could improve that for the round 2 application. So they are moving forward with the round 2 application. And as part of supporting that project, one of the areas that we identified was to get the local government units a letter of support to include with that application. The city of Elk River has already provided a letter of support for this project that was included with their first round, but they did ask if we could provide a letter of support for their senior housing project. So they're looking to develop an affordable senior housing project in the city of Elk River. And as we know, looking at our previous housing study that we have, there is definitely a deficit, which I referenced in the letter of support, of about 1,600 senior units that we need to satisfy the demand for residents through 2030. So I did tell them that I would bring this forward to the EDA to see if we could offer a letter of support to include with their tax credit application.
I've worked with John Duffy is a great person to work with. He's very committed and funnels his resources into providing these kinds of opportunities for housing. So I have no problem. I will make a motion to support this letter for the Duffy development in Elk River.
All right, thanks, Rand. Do I have a second?
A second.
Laura, all in favor?
Aye.
Opposed?
And with that note, can you reach out then? Have you had any conversations with Aon? Because they're still trying to go after their tax credits for the other portion of their, because they own, I think, almost 6 acres in Big Lake over by the North Star Station. They finally got the credits to do the senior component. They pivoted, but yet, as we well know, there's still a huge need for affordable housing for families. So can you maybe get together, touch base, and see if there's something we can do to help support their application and their tax credits?
Yeah. How do you spell Aon?
A-E-O-N.
Teresa is very familiar with that
Yeah,
program.
Teresa, get together with Teresa, she'll be able to.
Okay.
That's why I was going, you two get together.
And we're gonna have Duffy Development be a speaker here at some
We
point
are.
too to talk about, they have quite a few properties in Sherburne County.
He's a very, very, very.
All right, home local housing trust fund update.
Yeah, so myself and Health and Human Services did a Part 2 workshop for the county commissioners for housing on February 20th. There is a statewide affordable housing aid, which is an appropriation from the state of Minnesota to go towards housing that Sherburne County is receiving in 2023 and 2024 in the amount of about $157,000 for 2023 and 2024. We've been talking about a local housing trust fund and establishing that and making that recommendation to the county commissioners. So I was asked to speak at that workshop, and I advocated on our behalf of the EDA to establish the local housing trust fund. And I had asked that $157,000 be used as seed money to start that local housing trust fund. And I realized that wasn't a whole lot of money, so I also did a little bit of research and found a state grant, a local housing trust fund grant that the state has that we would be able to apply to for up to $150,000. And then we would also have to provide a $150,000 match. So I did ask that if there was $150,000 that the county could dedicate, that's not state or federal funding, to use as that match. And the result of that meeting was that the board did approve to move forward for our legal team to begin establishing that local housing trust fund. And if everything works out the way that we're hoping, we should have about $457,000 in that local housing trust fund to get us going. So with that, one of the benefits is that when that statewide affordable housing aid is deposited into the local housing trust fund, it's considered spent. And otherwise, we would have to spend that money, or the county would have to spend that money in 2024 before that 2024 appropriation.
At the end of 25.
25. Okay, so otherwise there is a clawback to that. But with it being put in the local housing trust fund, it's considered spent, so we'll be able to take that time to research and make some thoughtful recommendations for programming that we want to administer through the local housing trust fund. And we'll be able to wait for our housing study to be completed so that we can use the data from that to inform our decisions as far as those programs are concerned.
Let's say so we can control the program instead of the program control us, so.
That's the idea. Are you? I see Bruce wave his hand, so did you have something to say?
Could just add in, the other thing the board kind of tentatively agreed to, but it'll be a budgetary issue every year, is going forward, the housing funds that we receive, and it's assumed to be annual, there will be a continued infusion of funds into the trust fund then. It'll be mixed a little bit with supporting some of the housing services that you heard about today, in health and human services, but the idea would be that that recurring revenue would continue to be some sort of a revenue stream. And then the last thing is we'll continue to work on the issue that was raised about the roles and responsibilities of the HRA versus the EDA and define that. But since the EDA is up and running and has staff, the HRA is not. Our, at least staff's preference would be that we use this body as the, if not the decision-making body, then the recommending body to the HRA, which technically is the county board. So still a little bit of work to be done there, but at least we got everything going. And kudos to Jessica. She went in asking for $157,000, came out with $500,000, so that's pretty good work.
All you can do, Jessica?
And the board did approve yesterday moving the $150,000 match into the housing program, so that part is
That's
done.
official.
So then, Jessica, you would be administering that for now?
Well, we got a lot of work to do before we get there, and I'm sure that it wouldn't just be the EDA. I think we'd probably serve more as like a recommending body of which, you know, we'd have those conversations here. But to the, as far as like developing programs and things, the Minnesota Housing Partnership and Elizabeth Glidden, who was here last month and was talking about local housing trust fund. So I did apply to their technical assistance. It's free if you get accepted, and we got accepted. So as part of that technical assistance, they provide that really in two different buckets if we would like to use them. And I can elaborate a little bit more on those two buckets. They do community engagement work, and so some examples of that would be they're currently working with Stearns County, which just passed their local housing trust fund ordinance, and they're working with them on a community engagement process with key cities around their county. The process is both to socialize the local housing trust fund and ensure cities know about the local housing trust fund and the ways that the county can help, and then to get input on what programs to prioritize for the local housing trust fund. And she said they'll also do some type of reporting at the end of that engagement. And they also did a similar type community engagement process with Otter Tail County. And then they also can provide technical assistance for program design and implementation. So for an example, they worked with Crow Wing County, which already had identified 3 programs that wanted to implement with their local housing trust fund dollars on designing the objectives and administrative guidance processes for those programs. And then they also worked with Carver County to help make their presentation to the board prior to ordinance adoption. And then now they are going to be helping them with implementing the programs they will fund through their local housing trust fund. They know they want to fund home ownership programs. So she's helping them look at sample programs from peer communities and make decisions about program parameters, and then we'll help them work through their set of administrative questions. So as far as like actually identifying appropriate programs that are going to be in alignment with what we're hoping to accomplish and making improvements off of the housing study data that we're going to get, and then really looking at the administrative and program parameters, they can help us with that and provide a lot of different input from different communities. So I'm assuming that is technical assistance that we'd want to take advantage of.
yeah, I would think gaining all the knowledge and experience of people that have been doing it would be helpful.
Yeah.
Not that we might follow it lockstep, but
Right.
we're definitely, as I see it, still in the information gathering part of this deal, so. I think if we can control ourselves to understand that we have a lot to learn and a lot to set up before we move forward, I think we'll have the best chance of a successful program and allocating those dollars where they're gonna be best used.
And then with the housing study, just kind of as a side note, next month's meeting, Matt Mullins will be coming back for the kickoff meeting for our housing study. And I've also invited Mitch and Mark from Planning and Zoning to come be a part of that kickoff meeting. So if I could, I just want to kind of read 3 bullet points that was identified that we'll accomplish in our kickoff meeting. They want to meet with us and other stakeholders to review project goals and objectives and then refine the work program if required. They would like to conduct a windshield survey of the housing stock in the county, and then they'll provide us with some data for comparison purposes to other counties and communities to kind of give us some ideas of what we want to look at. I know there were some specific things that folks wanted to be included in that comprehensive housing study. I have a list here also from, who sent that? Todd, yes. And of some things that he would like to see in there. So whether they could already be included in that scope, but just to have that conversation during the kickoff meeting to make sure that everything we're looking to accomplish is included in there. So that will be the April meeting.
Okay. Anything else on the trust fund? Kind of a big item. All right, on to the homegrown workshop feedback.
So we did our homegrown workshop in February. It was a good workshop. I just have some of the kind of the key takeaways for that. So that was the identifying and improving your entrepreneurial network within the community. Essentially, just to sum it up, at the end of the workshop, they kind of put us into 5 groups. And we had a rules group, a money group, a community group, skills, and culture group. And from there, our roles within that group were to identify what we could do, what we should do, and what we will do to improve the entrepreneurial environment in Sherburne County. So just some key takeaways that I wanted to just lay out there. Some of this we're already doing. Some of it's not a, Dan, you're on that committee, so then you can just do it and then it's done. It's an ongoing effort, some of these things. So within the rules category, the rules group identified that we will, or we definitely need to look at remove the job creation component of it says remove, I would say it should be revise or at least look at the job creation component in the abatement application. I think some of the thoughts on that are that we're requiring jobs for the abatement applications. However, there's not enough workers, not enough houses, that type of thing. So it just has it's difficult to meet those. But I know we did some work on the abatement application that kind of softened that a little bit or made.
It helped smaller businesses.
Yes, yep. And then the other thing was to host workshops on business rules. We kind of did a little bit of this when we did our Welcoming Wednesdays. We had the start to finish from getting incorporated to, we had legal there, we had insurance, we had all different kinds of people there to help a business from start to finish. But I do think this is definitely something that we could continue to do. So we'll probably look forward to hosting another one of those types of workshops in the future. Under money, we had Sherburne State Bank, Marissa McKee. She said that she would help us gather a list of available funds at the city, state, county level, even federal, for businesses, and just kind of have like a resource guide. So that's a will do that we're going to be completing. community, promote networking opportunities, and teach entrepreneurs how to engage. I think this is just an ongoing and part of what I do on a regular basis when I go to chamber meetings and B&I meetings and things like that, just to constantly be promoting those things. And if I meet someone at one meeting and I think they should really know someone at another meeting, it mutually benefit their businesses. I'm constantly making those connections. Under skills, connect and meet with schools, emerging employment trends, and that could, really be helpful to align employers with internship opportunities or things that the schools are doing. And the school does a lot of that on their own. But I have met with and identified manufacturers who would be open to having interns there. It's just they're working in their business day to day. They're not going to go tell the school that. But if that's something that we can just all kind of be aware of, or if you know of other industries that would be open to having interns, just let me know and I can make that connection. And then under culture, entrepreneurial development. So I know you guys are aware of the City of Becker and their $150,000 grant that they received from the Just Transition Fund. There's a couple things I want to talk about with that. The first thing is the ILT Academy. So we are doing the entrepreneurial development cohorts. So the way that Becker and Sherburne County has agreed, well, I shouldn't say agree, that they're letting us, because it's their grant. There are 20, well, there's two cohorts coming up here this summer. There's one this summer, one this fall. They have enough grant dollars to sponsor up to 20 participants in those cohorts. It's $3,000 per person to go through these 10-week cohorts that they have. They would like to retain half of those for the City of Becker if they can fill them, and then the rest I can spread across the county. So we've met individually with each high school, their DECA programs, their entrepreneur classes, the CTE coordinators, and just let them know that if they have any entrepreneurs that they're aware of in their school district 16 plus, that they can apply to this program, and through that grant their fees will be paid. But it's not just for high schoolers, it's also for small business owners. It's for, it could just be someone with an idea who would like to advance that and kind of try to kill their idea, if you will. Their philosophy is fail small, and then build from there and continue on and start your business. So we are working with them. Hi, Nicole. Do you want to say anything about this program?
Spread the word. Honestly, if you know anybody that's interested or would be a good candidate, have them apply. The QR codes are for this summer program, and the application deadline is June 3rd. It's one night a week, Thursdays, 6 to 10. Mm-hmm. Yes, spread the word if you've got employees, supervisors, anybody that would be interested. It's not just for entrepreneurs with an idea, it's also for business owners, like Jessica said. So.
Can I add to that? I've gone to some of the ILT academies in St. Cloud. They meet, I think it's every other Wednesday. I get the dates mixed up with Nick Teets, the guy that puts it on. And I don't know if you know Claire Richards, but she's in the St. Cloud area, and a lot of people know her. I know her personally and professionally, and she's somebody who's gone through this, and it's an amazing program.
Yeah, we're really excited to be able to bring this to Sherburne County, and so as much as anyone could help spread the word, please do. I think we've got some pretty promising applicants that'll come through right out of our high school. Nicole and I were just in Becker on Monday, along with Nick and Ezra from ILT, and we presented to their DECA group, and then we presented to their entrepreneur class and ran them through an exercise and just on like business idea and building a quick business plan, acting it out, creating a pitch. It was hilarious, to say the least. These kids are so creative, but really educational, and just like to have the speed version of this program and to see it in quick action, it was a lot of fun. So we're excited about that. Also with that, the City of Becker has received $100,000 for technical assistance. So that's in addition to the $150,000. And I know I talked about this before. but I'm gonna bring it up again. The big idea with applying for this initial grant with Becker, so this is a Cole Communities Get Ready Challenge grant that they received. And that grant is intended to get communities ready to apply for federal funding. And so we have identified a federal grant called the Economic Adjustment Assistance Grant, and that the city of Becker or Sherburne County or in a partnership has plans to apply for funding for a business incubator facility. And that is the big idea with this. I just finished writing the RFP for a consultant, which is required by the federal EDA to do a feasibility study and market analysis for a business incubator. And we're able to use that $100,000 in technical assistance for that feasibility study. So that's kind of the next step in this process that is currently sitting with Nicole right now, so.
So you got a grant to learn how to get a grant?
Pretty much.
Love it. All right. Anything else?
Sorry.
Quick question on the incubator startup. I mean, for our land use, we see a lot of, the home business and accessory buildings. Like, we always joke around, this is the land of entrepreneurs. County, it's like, here's your accessory building and here's your permit, for your business. So where are they doing these incubators, like?
So we don't really know. That's part of the feasibility study that we're hoping within that RFP scope of work, they're gonna identify the most appropriate place for that. Yeah. I would say likely in Becker. Yeah.
Any other questions? All right. Bylaws and enabling resolution review process. Dan, is this you?
Yeah, at our annual meeting, we had discussed this and it was time to review. It's been 5 years since we've taken a look at these. I know one thing we want to change is to move that annual meeting to the third Thursday. So one thing will be changing automatically. It requires a public hearing. So if we want to change multiple, now would be the time to take a look at it.
So how are we gonna approach that?
I would propose a committee of the chair and vice chair, and then one commissioner. And the four of us take a look at it and bring it back to the full EDA for discussion.
Okay.
Are you all right with that, Mr. Chair?
I agree with that. So Andy and I were told what we're doing. Which commissioner are you going to?
Are there any volunteers in the room?
Just want to get this done and not have any loose strings.
How convenient for Andrew to.
Right.
Good timing.
I'm good with that, yeah.
I don't think this will be a big time drain.
Okay, is there anything else that wasn't on the agenda that anybody would like to bring up?
Can I just provide one little update too? So we had the housing home ownership workshop. That was on that last Wednesday. And so that was where I had Minnesota Housing come and talk about their fix-up, startup, step-up, and down payment assistance. We had only 7 people attend. However, we had the right 7 people in the room. And when I talked to Minnesota Housing, he said it was a good turnout and that we had the right people in the room because they had a lot of great questions. They stayed after. They were people who truly needed those resources. So I'm gonna put that in the win category. We also have the Builders and Developers Workshop, same kind of thing. Minnesota Housing is gonna come and talk about their new programs that they have for supporting housing development. That's gonna be on April 10th from 10:30 to 12, and that's here in the Government Center as well.
How are you getting that message out to the builders?
So I actually spent a day going to the Parade of Homes. And so I looked up the Parade of Homes and what developers were there, and I think I hit about 9 different developers across the county and dropped off our information and shared it. And then I am also gonna tap into my connection with Molly Nadeau at Treadstone, and she's gonna help me reach some of those developers and quite frankly, any other person who would like to help market that.
Ken, do you have any abilities with your contacts?
Well, I would suggest maybe pulling up the licensing data from the state. You can get a list of all the licensed contractors in, this area.
Can you sort by zip code on that, do you know?
I don't know, I've never.
Jessica, if you wanna send me that, I can get it out to people.
Yeah, absolutely.
There you go.
Yeah, planning and zoning, when there's a heading on that, that gets people's attention, they'll open it.
How about CMBA? That's what Wanda.
What's that?
How about Wanda at CMBA with that?
Yeah, okay.
That would have been part of the parade of homes, right?
If I could just introduce Mitch Kleins, some of you know him. For the planning and zoning department, we had some transitions. I moved up to assistant zoning administrator. Mitch is going into my role as senior planner. Zoning specialist, what else do we want to put under here? Yeah. And so, but Mitch has a good background in development. His father did a fair amount of development in Sherburne County, he was a surveyor and a developer, so comes from the kind of the private side, and he's been with us for 7 years now, Mitch. So he and I will attend these meetings. One of us will be at this meeting because we really do value this relationship.
Well, thank you. I apologize, I should have made that introduction, but I've known Mitch for so long that I thought everybody did, so, you know.
Yeah, he's a good resource for the county, and it's a nice skill that he brings, kind of perspective that he brings.
I was just curious too, Jessica, if you could, reach out to some of the, realtors that, are more in they are the ones selling these big parcels of land, so they are dealing with developers as well. Maybe they have like some people that wouldn't pop up on any other list, although I'm assuming they probably would, but it doesn't hurt.
Okay, so if there's nothing else, I'd entertain a motion to adjourn.
I'll make a motion to adjourn.
Second.
All in favor?
Aye.
Thanks, everybody, great meeting, a lot of information.